Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is New Medicare Benefit for People Living with Dementia, presented by Monica Escalante. Sponsored by Prince George's County Government and the Department of Family Services.
Today it's my privilege to present dementia care today, and I can see we have 12 attendees already in the room. My own father died with dementia, and I watched the progression of his disease. So I'm going to make reference throughout the presentation today to my own experience as an adult child having to care for a parent who's declining progressively over a long period of time, which is the case of dementia care. So we at Hospice of the Chesapeake have created a guide for the community, and we want to share that with you. Why this is important, you're looking at your screen right now. 6 million Americans suffer from dementia, and that figure will more than double by 2050. 1 in 3 seniors dies from Alzheimer's right now, either Alzheimer's or another dementia. It kills more than breast cancer and prostate cancer combined. Over 11 million Americans provide unpaid care for people with Alzheimer's or other dementias. And this is also quite alarming because between 2020 and 2030, 1.2 million additional direct care workers will be needed to care for the growing population of people living with dementia. This is the largest worker gap in the US. Our guide provides a lot of information to help those additional caregivers that are going to be needed to meet the needs of this growing population. It is our hope also that with the information that we're providing today and the programs we're developing, we're going to try to prevent hospitalization and needless pain and suffering. Those of you who know someone with dementia, you know how disorienting it is for them to end up in the ER. So, and how much it affects them emotionally and physically. So that's one of the goals that we have today, that we're going to try to provide tools for the caregivers to prevent that. So it is also quite alarming that Prince George's County is one of the largest, the counties with the largest incidence of Alzheimer's in the nation. Actually, together, Baltimore City and Prince George's County are at very top. You can see those statistics here, that the higher prevalence of Alzheimer's dementia was estimated in the east and southeastern regions of the US, with the highest in Maryland, New York, Mississippi, and Florida. So this is already happening. So this is a snapshot of our dementia care resources guide, and this is what we call the patient and caregiver resource guide. Now, this one is a guide that could be used in all phases of Alzheimer's or other dementias. And what I'm going to try to do is walk you through what is it that we can do. For us, Hospice of the Chesapeake, we can provide the most support to families dealing with Alzheimer's or dementia if your loved one qualifies for hospice care. And I'm going to explain exactly what that means in terms of disease progression. There are different types of dementia, and dementia is actually an umbrella term describing symptoms causing a person to have changes in brain function that interfere with their ability to function and to do everyday activities. So we're mentioning 4 different types of dementia, but there's others. So Alzheimer's, what we know about Alzheimer's is a progressive type of dementia caused by changes in the brain. These changes occur due to abnormal protein deposits that damage nerve cells, leading to decline in the ability to think, reason, plan, and remember. Now, another type of dementia is vascular dementia. Vascular dementia refers to cognitive decline associated with a stroke or some type of vascular problem within the brain. These problems reduce the amount of blood flowing to the brain, depriving the brain of the brain tissue of oxygen that needs to work properly. And this is the type of dementia that my father had. They referred specifically to his dementia as molecular degeneration of the brain, and it was following a stroke. The other one is Lewy body dementia. Lewy body dementia develops when a protein builds up in the brain, and these protein deposits are known as Lewy bodies. And there's other types of dementia that I'm not going to explain today, but many people feel it's just senile dementia, but it will also progress over time. And almost all of them progress in a parallel manner. So what are the common symptoms of dementia? It starts with memory lapses, with confusion over words, with changes in mood or personality. Suddenly they have trouble with abstract thinking. Then they start having difficulty completing familiar tasks, like they start forgetting where things are, and they forget their words. And there's changes in sensory perception of environment. For instance, my dad at that point got lost in the neighborhood, a neighborhood he knew well. He just couldn't find the house back. They also misplace items and struggle with that. And of course, there's impaired judgment and inability to make decisions as a result. What are the stages of dementia? We're going to divide dementia in 3 different stages. The first one is a gradual onset, as I mentioned, forgetfulness, word finding difficulties, problems with memory and concentration, misplacing things, trouble organizing and planning, and difficulty remembering to take medications, which has a ripple effect in their overall well-being. So this is what we call the first stage. Sometimes if the disease progresses over 10 years, this is probably what is experienced in the first 3. Now, there's no one way that this disease progresses. For other people is 7 years, and that can be very, very different from one person to another. So the second stage that we have on our guide is the middle stage. There are more obvious problems with memory, and I think the family is already well aware that something is happening. This is when a lot of people start getting diagnosed better because they are lost in familiar places. They may have difficulty recognizing family members. They need extra help with eating, bathing, and dressing and toileting. That's they become too incontinent, and that's very difficult for the primary caregiver. And there are increased difficulties in communications. The words don't come as easily. They can't really recognize some people at some point. So potential behavior and personality changes because they are getting very frustrated themselves. Imagine if others that are not experiencing that from a moment to moment, for the person who's experiencing that, it is very frustrating. And the last stage, and this is where hospice can be a lot of help for the caregiver, for the family. They are more dependent on the daily activities. They have difficulty walking. They may no longer be able to be verbally communicative, and their memory gets worse. At this point, I remember my dad just didn't recognize anybody except my mom, who was with him all the time. The personality changes because everybody's a stranger, and there's a lot more fear. And sometimes that translates in different ways. Other people get angry. There's swallowing and eating problems, and they may lose the ability to control going to the bathroom. They are in need of incontinence supplies. By the way, Hospice of the Chesapeake provides that for the patients that are under our care. And they may have recurrent infections. And all of these symptoms can be very well managed under hospice care. Now, many people don't realize that President Carter was under hospice care for almost 2 years, and that is perfectly fine under the Medicare hospice benefit because he continued to decline over the course of those 2 years. So what is it that hospice offers for the final stage, what we call the end stage of dementia? That a nurse will go to the home and will evaluate the patient at least once a week and with more frequency if necessary. And this nurse will be in close contact with the attending physician, which could be the attending that the patient had all along, or it could be an attending that is a member of the Hospice of the Chesapeake team. In any case, both of them will monitor their care. We will also provide a lot of education for the family, tailored to the specific needs of the family. And we have durable medical equipment that comes to the home to help provide the care in the home. That includes electric beds, bedside commode, walkers. If there's difficulty breathing, there's oxygen, there's portable oxygen. We also take care of all the medications related to the primary diagnosis, and they are ordered by the attending physician or our team physician to control the symptoms and to make sure the patient is comfortable. That becomes the main goal, the patient being comfortable and the caregiver feeling supported. There's additional team members that come to support the family, like the social worker, the nursing assistant who can provide personal care, a chaplain, a counselor, and other members of the team. In many cases for advanced dementia patients, we have a music therapist coming to work with the patient, and it's amazing what music can do for someone with dementia. So it takes a team, and the key element is that the team is there not only to support the patient, but they support the patient and the family. So these are the tools that are under the dementia care resources that we are providing. This is a free document that can be downloaded from our website, and after the presentation I'm going to send a PDF with it, but I also will send a link so anybody can download it however many times you want and share it with whoever you find is necessary. Communication is very important when you have someone ill at home, and even more important for someone living with dementia that has difficulty expressing their thoughts, feelings. That can make the person frustrated and the caregiver very frustrated as well. So it is very necessary that you practice the way you talk to the person with dementia, and you set the tone for a calm communication and not everybody anxiety or discomfort escalating. So how can communication be improved? And this is just one page of the Dementia Care Resource Guide. We have a lot more content in the guide, is that have patience when talking to a person with dementia. Try guessing or helping out if they're having difficulty finding the words or telling you what they're intending to do. Give them options so that they can feel understood. Use simple, easy to understand sentences when talking to them. And please don't say, "Do you remember?" because that's the very thing they have a lot of difficulty with at this point. Avoid becoming frustrated or lashing out. That's not going to help anybody, and it's just going to make the patient feel more agitated. Always remind them where they are, who they are if they forget, and if they are confused, they may not be able to understand what you're trying to tell them. So when I went to visit my dad, he didn't know that I was his daughter, but I kept calling him dad, dad, dad. So he would say, "Oh, that's my daughter." He could continue the conversation without feeling that I was a stranger to him. There's a lot of very important information in this guide, but I wanted to touch on a key element that happens when dementia advances, and it's the issue of placing a feeding tube or not. And I've been doing hospice care for over 20 years, and I've seen numerous cases where the family feels that they cannot stop feeding the patient. And it seems to me that sometimes the decision to place the feeding tube is easier than the decision to remove the tube. So doctors that I've met in different areas of the country repeat over and over that it is no help to place the feeding tube, and it's only a burden to the families when they have to remove it, because there's no evidence that those feeding tubes help the patient live longer or become stronger. And they are more a discomfort and a risk to the patient living with dementia. So just if you remember one thing about this conversation, just talk to the attending physician if anybody's contemplating artificial nutrition for a person living with dementia. Pain is another area that I would like to leave you with some tools. As an individual's dementia gets worse, it may be harder for them to know when they are in pain and tell about it. As a caregiver, it is important for you to manage their pain as fast as possible. If the pain is not treated, it may cause more problems in the future for you and for the person living with dementia, including unnecessary suffering and agitation. So physical pain, it's very important to be aware of how it manifests. So pain is different for every person. Some of us are more sensitive to pain than others, and pain can be difficult to check in a person living with dementia, as they may feel it differently, or they cannot clearly tell you what they are feeling. If pain is not treated, it may cause depression, frustration, agitation. It may restrain them in many ways because they can't move due to the pain, and they become isolated or sometimes aggressive. So causes could be arthritis or gout, diabetes, bone fractures from osteoporosis, maybe a progressing cancer, maybe they got shingles. Sometimes because they are not as mobile, they could be having lower back pain, sciatica, physical trauma. And very often they are very prone to urinary tract infections. So what are some ways a person living with dementia might communicate pain? Sometimes they hit the area where the pain is, and the motion is like they're trying to release the pain so it goes away. Other times they cry, or they start yelling, or they feel restless, or they are frowning and tensing up their body. Other times it's just withdrawing. They just don't want to do much. Please remember that pain is more than just physical. It is emotional, mental, spiritual, and some of these tips may help you with all those different types of pain as well. Other topics that are also developed in some detail in this resource guide is sleep disturbances, and there's some tools for the caregiver to help with that. How can we help the patient sleep more comfortably and for longer periods of time? Other ways to help the patient and the caregiver is with agitation and aggression, constipation, depression, driving. I mean, that's a big conversation to take the car keys away when it's no longer safe to drive. Dealing with hallucinations and delusions, dealing with incontinence, pressure ulcers. In many cases, some people become sexually disinhibited, and they display behavior that could be perceived as really aggressive of totally out of line. Sometimes they're sundowing or wandering around. That's our guide provides some tools for all of them. The other key issue that is not only for dementia patients, but it really affects a lot of people living with chronic illnesses, is the fact that many seniors are taking medications that are no longer providing benefit to them. And very few practitioners do a full medication reconciliation for them. And this is something that we do when we enroll patients to hospice. The very first visit is all of the medications, including out of off the counter medications. We put them all on the table, and our doctors look at them and try to assess if these medications are still helping. And if they are not helping, then they may be interfering with the effectiveness of other medications, because they may be burdening the liver and other organs unnecessarily. So it's very important to talk to the attending, even as caregivers, to your attending about medications that you may have been taking for a long time but may no longer be effective in the course of treatment. And definitely we see that with most patients that are enrolled in hospice. And for patients under GUIDE, which is the new Medicare program, we're also going to do a full medication reconciliation. And I will talk about that in a few minutes. So just remember that sometimes medications that are not helping are getting in the way. And in many cases, the patients with advanced directed dementia have difficulty swallowing. They don't want to open their mouths anymore. They are spilling medications out, and they are more groggy, and may not benefit from some medications at all at that point. So when we are dealing with dementia, it's important that we understand the baseline, what's the usual behavior, and when to call a member of the hospice team that can help with these sudden or unusual changes, and also understanding what those mean in terms of the care of the patient. How can we keep them comfortable in the light of these sudden changes? The guide elaborates on all the different options we have at that point. So I've talked a lot about this dementia care resource guide for caregivers. And this is a photo of some printed ones. And you can request them on our website, and I will send those links. So now I want to talk about the new program guide, a new Medicare program for people living with dementia. This will allow us to support people before they are eligible for hospice care. So when they are earlier than end stage. So this program is called Guiding and Improved Dementia Experience, and that's why they call it GUIDE model. And it started last year in July 1st, and it's an 8-year program, and I will explain what happens under this program. There's different options for different patients who will qualify for these services. So care coordination and management, we will have navigation services for the patient and the family. Now, understand that the healthcare system is quite complex, so a navigator can help the patient, the caregiver, and the family know all the services that are available to them, and have ways to access them, schedule doctor's appointments, know doctors that specialize in different areas of need for the patient. So care coordination is a big element. Then caregiver support and education is another important one. There's a lot of caregivers that are juggling with full-time jobs or working from home and caring for a patient with a dementia diagnosis. So these services are intended to help them do what they're doing better, and knowing all the resources that are available to them in their respective areas and how to access those. And finally, respite services. And please know that respite services are not available to everyone, but only to qualifying patients. So you have to meet a certain level of need to qualify for respite patients. But nevertheless, there are some of these respite services available, but there's a cap of $2,500 a year. So this is how we show the level of complexity. So beneficiaries with a caregiver can have low, moderate, and high complexity. And beneficiaries without a caregiver go from low complexity to moderate, and depending on the stage of dementia they are experiencing. So the guide program will allow for 24/7 access to a support line, caregiver training, caregiver education. The goal is to reduce hospitalizations, to assess caregiver burnout, and mainly to prevent it, caregiver navigation services for complex medical needs, respite services if they are eligible, and screening for health and social needs. Again, the goal is to allow people with dementia to remain safely in their homes for longer by preventing or delaying nursing home placement and improve quality of life for both the people living with dementia and their unpaid caregivers. And this guide program will go on for 8 years. There's one caveat: if the patient is under a Medicare Advantage plan or on a PACE program, they don't qualify for the guide program at all. So let me repeat this. If the patient is under a Medicare Advantage plan or under a PACE program, they do not qualify for guide. So the payment structure of guide is look at for the first 6 months for low complexity, moderate complexity, and high complexity. The fees go from $150, $275, or $360. This is what we as the provider, Hospice of the Chesapeake, will get paid on a monthly basis. So this is the monthly fee, which quickly goes down after 6 months to $65, $120, and $220. So this is, we know as Hospice of the Chesapeake that we need to fundraise to underwrite some of the extra needs that the communities we serve are going to have, and that these monthly reimbursement will not cover the extent of need of services we intend to provide. Just to give you an example, for in-home respite, for a 4-hour unit respite is $104. For a facility-based respite for 24 hours is $260. And for an adult day respite, 8-hour unit is $78. And if you are familiar with the fees in Prince George's County, you know that this is already under market price for these services. So the model has different tiers, and this is kind of a lot of information here, but again, low, moderate, and high complexity. And the FAST score, some of you may be familiar with the FAST score, and that's how the assessment is being guided. And the FAST score is probably one of the better known scores to assess the disease progression in terms of patients. So that's how these complexity levels are determined. And last but not least, please know that we have a caregiver support program, Caring for the Caregiver. This is free for the community. It's done via Zoom. It's the second Thursday of each month from 10:30 to 11:30 in the morning. And this is available to all caregivers. And this is an ongoing service for the community that Hospice of the Chesapeake offers. For the guide program, we are starting it in July, but we're starting it in a small, very controlled way, because there's a lot of subtleties that Medicare has created with a great degree of difficulty for the providers. So we want to make sure we navigate initially on a pilot basis before we open the doors to the community at large to care for them. So we are starting it this month, but we're going to start it in a very limited capacity way, and we hope to be able to increase the number of people that we are caring for under guide in the upcoming months. And I hope to stay connected with your organization so that I can let you know as soon as we are opening the doors for the community at large to benefit from guide support services.